My family member seems depressed but refused to see a doctor. What can I do to convince her? As you may have guessed, the answer is it depends. Because in order to convince someone, we have to first understand what's behind their reason of resistance. One of the most common reasons that people feel uncomfortable to seek mental health help is the stigma associated with it. Because there's always this fear of being seen as mentally weak or grown iman when you come to seek for psychological help. But even though we know that depression and anxiety is not entirely due to how a person thinks, there's a lot of chemical associated with it also. But the easiest way to convince someone to come to a psychiatric clinic is usually still telling them that they have to fix their sleep. Because most people are very comfortable to come to see a psychiatrist for insomnia or sleep problems. And most psychological issue, anxiety, depressions, usually comes together with problem with sleeps. Another common reason that people don't want to see a psychiatrist is that they believe all the psychiatry medications will be addictive. If this was the reason, what we usually try to do is explain to them that not all the medication prescribed by a psychiatrist will be addictive, and there's usually a course of treatment like 6 to 9 months, and then the patient have the options to stop the medications. And sometimes, just to be real, we also hear that some people are afraid to see a specialist because of the financial costs. Because the cost can range quite widely, like 200 ringgit to 800 ringgit or even more. Fortunately, a lot of clinics and hospitals are trying to be as transparent as possible. So if you are not sure about the cost and that worries you, you could always call the clinics or WhatsApp the service provider, and then they can give you a ballpark of the price cost. But again, in order to convince your family members, you really have to start with listening and try to understand why they are feeling reluctant to see a psychiatrist. I hope this helped.